At this time, I'll call the York County Council Public Budget Hearing Meeting to order. Let me read this. Council to hold a public hearing on an ordinance to establish operating and capital budgets for the operation of the county government of York County for the fiscal year commencing July 1st, 2021, to provide for the levy of taxes for York County for the fiscal year commencing July 1st, 2021, to provide for the expenditure of tax revenues and other county funds, and to provide for other fiscal matters relating to county government. Mr. Madden, is there anything that you would like to present before we open the public hearing?
Currently, the budget as it stands in recommended county council has no countywide millage increase. There are 3 millage increases related directly to fire service, one for the York County Fire Service for more firefighters and staff, and 2 fire districts. There's also a millage decrease at the Lake Wiley Field Day Park, and there's a new tax district on board that was approved in the voter referendum that's coming in that has that millage in place. Other than that, taxes are remaining unchanged for the citizens.
Thank you, Mr. Madden. At this point, I'll open the public hearing. If there's anyone who wishes to speak to the council on the budget, please feel free to come forward, and you can state your name and give your address, please, and then you can address the council. As a reminder to the council, public budget hearing is a time for us to listen to the public, and there's no action item for council to make, so sometimes folks get confused as why aren't we doing anything. The whole purpose of this meeting is to give you the opportunity to speak and for us to listen. Please come forward.
Hi, good evening. My name is Tamara Edrington. I am the Executive Director of Catawba Community Mental Health Services. Our primary office is located at 448 Lakeshore Parkway, Rock Hill, South Carolina, 29730. Do you need a phone number as well? I'm sorry.
That's fine.
Okay. We provide mental health services to the citizens of York, Chester, and Lancaster County, having 2 offices plus our administration office here in Rock Hill. We currently provide services in the form of mental health, individual, group, and family therapy, psychiatric care, including psychiatric nursing services and medication management services. We also function a fully operational primary care component to our behavioral health, where we provide underinsured citizens of York County with primary care services either free or at a reduced fee due to the lack of insurance. We also provide crisis bed funding for Piedmont Medical Center for uninsured citizens of York County for psychiatric services. For the month of April, we were able to spend $122,000 to cover the inpatient bed days of mentally ill citizens of York County. May, we just dispersed $96,000 to cover the cost of uninsured citizens of York County. We currently have a census of about 3,800 active patients, with about half of those being York County only. Our services ranges from children as young as 2, and we provide geriatric care, and there is no end date to the services that we provide as far as age limitations. The majority of our patients are our adult patients who suffer from severe mental illnesses in the forms of schizophrenia, bipolar, major depressive disorder, and they are revolving in and out of inpatient services in addition to our detention center. I currently have a staff member providing services to the inmates at Moss Justice as well as York County Prison, where those patients are seen free of charge as well. I have my Chief of Staff, Mr. Reginald Brackett, here to give you some data and some statistics on the number of services that we've provided through the 3rd quarter of fiscal year 21.
Good evening. Currently, we have 2 facilities as a part of York County. It's called our York Adult Clinic, as well as Catawba Family Center. At the current time, the York Adult Clinic, we have over 1,400 patients. Within that 1,400 patients that we have thus far, up until this quarter, have had over 15,000 contacts and over 5,000 unduplicated contacts. Currently, as far as our patients are concerned, 23% of them have private insurance, 36.29% are self-pay, and 20% are do not pay any monies. That's at our York Adult. At our Catawba Family Center, we have encountered more than 15,000 contacts, over 4,000 unduplicated contacts. This number will increase by the end of the fiscal year. Financially, out of Catawba Family Center, 5% of those clients are self-pay, and 20% have private insurance to pay for their treatment, and 72% do not pay for any services. These are just some numbers as it relates to our two clinics in York County.
Catawba Community Mental Health Center is one of 16 mental health centers that provide mental health services for the state of South Carolina. We are an umbrella agency under the State Department of Mental Health. There's been a large misconception in the community and the state that we are fully funded by the state of South Carolina. That is misinformation. Our operating budget for fiscal year 21 was approximately $10 million. $5 million of those dollars were state allocation. The remainder of that $5 million are monies that we are set to generate through various revenue sources, such as billing of Medicaid and Medicare. And as you just heard from Mr. Brackett, approximately 30 to 40% of our patients do not have Medicaid or Medicare or any private insurance. So that leads us to request funding from county and city council, also me with writing grants for various opportunities, as well as contracts with various school districts. Right now, we are currently contracting with the school districts in York County to provide services to those students in their schools. However, those contracts do not fully fund the positions of the providers in those schools. So again, we have a hefty portion of our budget each year to generate through different and various revenue sources. That concludes my presentation. Are there any questions from the council?
We typically don't take questions, but we do appreciate the additional information and appreciate you coming here tonight.
Thank you so much.
Thank you. Is there anyone else who wishes to speak to the council?
Thank you for the opportunity to speak to you tonight. I spoke to you a couple weeks ago as well. I am Chris Johnson. I live at 1139 Woodland Drive, and I'm the chair of the Rock Hill Clean and Green Board. And we just want to take another opportunity to emphasize our position on increasing the recycling collection rate from $30 to $50. So I think we've given you a letter a couple weeks ago, but I'm going to emphasize some of the points that I made in that letter as well. We do have some Clean and Green board members here. They may wish to speak after I finish as well. So as I said, I'm Chris Johnson. I'm the chair of Rock Hill Clean and Green. Rock Hill Clean and Green Board is a Keep America Beautiful affiliate for over 25 years. It has come to our attention that there is a proposed increase to the recycling tipping fee from the current $35 per ton to $50 per ton in the fiscal year 22. The Rock Hill Clean and Green Board encourages the county council to remove the proposed increase from the fiscal year 22 budget for the following reasons. The proposed 43% increase in the recycling tipping fee is not feasible for municipalities to add to their budgets. At this point in the fiscal calendar year, municipal budgets have been planned and potential reasonable increases accounted for. However, this drastic increase is outside the scope of the traditional fee coverages, making it difficult to adjust the budget to cover the cost. As an example, the city of Rock Hill would need to allocate more than $26,000 in additional funding to cover the increase based on the fiscal 2021 recycling tonnages. If the recycling tipping fee is increased to $50 per ton, the current solid waste tipping fee of 43 tons would be less than the recycling tipping fee. This will make it difficult to justify recycling and the expense of having a recycling route for municipalities who do not market or process their material. Increasing the recycling tipping fee de-incentivizes recycling for municipalities. If the municipality cannot add the additional funds needed to cover the 43% increase, they will discontinue providing recycling services. Once curbside collection is terminated, some residents will continue to recycle and transport their recycling to one of the 16 York County collection recycling centers to drop off their material. The county collection centers will see a noticeable increase in volume of material and traffic. An increase in volume at the collection centers will lead to increased labor costs, more trips to empty the roll-offs, increased transportation costs, and higher maintenance costs. There is also a large potential for an increase in contamination of the recycling as residents learn the new system. For residents not willing to transport their own recycling to a drop-off location, material will go in the solid waste containers. This will result in an increase in volume at the solid waste tipping facility at the York County landfill. An increase in solid waste volume will lead to an increase in trips to Columbia to the MSW landfill, leading to an increase in transportation costs, truck maintenance, and labor. In Rock Hill, residents who are unable to or unwilling to haul their recycling and cannot fit the excess trash into the green roll cart will have to purchase an additional green roll cart. In addition, an additional roll cart will cost $50 and a 50% increase in their monthly sanitation bill. With the elimination of the curbside recycling service, Clean and Green expects to see an increase in litter and illegal dumping. Residents who are unwilling or unable to haul their recycling and who do not want to bear the cost of the extra green roll cart will turn to dumping extra trash on vacant lots, on roads, and in neighborhoods. We also know that the increased trips to the York County collection centers will mean an increase in unsecured loads, resulting in more roadside litter. Litter imposes a great cost to our economic development, quality of life, and ultimately the city and county will bear the cost of cleanup. And finally, with the elimination of curbside recycling, the York County Material Recovery Facility will see a decrease in material volume. York County taxpayers are still paying for the cost of the facility and will be frustrated to know that it is not being used to its full potential. The Rock Hill Clean and Green Board believes that an increase in the recycling tipping fee will end curbside recycling collection in Rock Hill and most likely in other surrounding municipalities. Recycling creates jobs throughout the state of North Carolina and South Carolina, supports manufacturers throughout the Southeast, reduces landfill waste and pollution, saves energy, and conserves natural resources. Residents who depend on curbside recycling will be frustrated with the elimination of the service caused by the county's increase in the tipping fee. On behalf of the Rock Hill Clean and Green Board, we encourage you to consider removing the $50 per ton recycling tipping fee increase. Clean and Green is happy to discuss this further or to answer any questions. Again, thank you for your time.
Thank you, Mr. Johnson. Is there anyone else who wishes to approach the council?
Good evening. My name is Adrienne Woods. I am the new Executive Director of Safe Passage. Before I go any further, I really want to thank you. The county makes a big difference in what we do and how we do it. We could not provide the services to the victims that we support in our community without your help. We work with law enforcement, we work with the solicitor's office, and it makes a difference in what the county does. So let me tell you a little bit about Safe Passage, and excuse me, I speak with my hands, so if you see me going too far out, just ignore this. Safe Passage provides 24-hour emergency shelter service, 24-hour crisis line services, advocacy, counseling, and other therapeutic services to victims of domestic violence, sexual assault, and child abuse. We work in York County primarily, but we also provide services in Chester, Lancaster, and Union County. Safe Passage is the only emergency domestic violence shelter in York, Chester, and Lancaster counties. The shelter provides a safe, secure, and secret location, not only for women and children, but also for men who are in domestic violence situations. Safe Passage is also the only child advocacy center in York County. The Child Advocacy Center provides a safe, trauma-informed, age-appropriate space for children to report domestic violence, abuse and/or neglect. And we also provide a child-friendly location for medical examinations. And I'll talk a little bit about that. We're also the only non-law enforcement program or agency in York and Union County that provides a 24-hour hospital accompaniment to sexual assault victims. So if someone is sexually assaulted, we actually send out staff to go there and provide assistance to sexual assault victims, children, men, and women. In 2020, we provided hospital accompaniment to 55 sexual assault victims. Those were virtual, but we provided them, and we received calls all times of the night. In 2020, we also provided counseling and advocacy to 50 sexual assault victims. We conducted 249 forensic interviews. That means 249 children came into our space and disclosed abuse or neglect. Those were in person. And those were performed by master level social workers or counselors, and all child advocacy centers across the state do not have the same level of expertise, I will say, that we have. In 2020, we conducted 110 medical examinations. So we are one of 4 centers or locations that are outside the hospital setting that provides a medical examination in a child-friendly room so that they're not in a sterile hospital being examined by a doctor. Excuse me. We provided emergency shelter to over 100 individuals last year. We handled more than 925 crisis calls. So despite COVID, we handled over 925 crisis calls. We provided 208 domestic violence victims with advocacy, counseling, and supportive services. And you might ask, why in the world are we needed? And many of you probably know the stats for South Carolina. In 2019, South Carolina was the 6th worst state for the rates of women murdered by partners. That's 1.5 times the national average. In fact, we have topped the list at least 4 times between 2000 and 2015. And we have been in the top 10 for the worst states for domestic violence for almost 2 decades. 41.5% of South Carolina women, 17.4% of South Carolina men will experience intimate partner physical violence, intimate partner sexual violence, and or stalking in their lifetimes. And this is according to the 2017 National Coalition Against Domestic Violence report. And to bring it even closer to home, in 2019, the Rock Hill Police Department reported 1,798 citizen-initiated calls concerning domestic violence. It represents a 45% increase over a 5-year span. In 2019, the Rock Hill Police Department recorded 550 charges of domestic violence. According to numbers I received from York County Solicitor's Office, in 2020, there were 143 domestic-related aggravated assault cases, and that's out of a total of 321. So almost 50% were domestic violence related. In 2019, that number was 158. In 2020, there were 28 domestic violence cases involving firearms. In 2019, there were 19. So we have an issue. And unfortunately, it pains me to say that in York County, last year we had 5 domestic homicides. One of those incidences included a 5-year-old child. His mother was killed and he was killed. Those victims were parts of our community. There was a nurse, a government employee, a small business owner, and an essential worker. They're us. So why am I asking for your support? And why do we continue to come back every year? It's because it's necessary. Over the last 3 years, Safe Passage has lost more than $300,000 due to funding, federal funding, because of the Victims of Crime Act. The Victims of Crime Act fund is funded by white collar crimes, but unfortunately, there's seen a 40% decrease in the revenue over the last couple of years, which means that there's a 40% decrease in revenue for law enforcement, solicitor's office, anyone who works in victims of crime, provides victims of crime services. We have been told, and we have budgeted out a loss of $100,000 because of cuts. And that's where it is so important for us and for our community to make sure that we continue to provide services to victims. We continue to provide a safe space, not only for domestic violence victims, whether they're men or women, for sexual assault victims who really need someone to be there with them when they have to go through one of the second worst experiences of their life, and especially for children who have been abused and or neglected and need to sit down in front of someone to tell their story. Someone who is trained, someone who's educated, and someone who's compassionate. So I ask you that you continue to do what you've been doing. We thank you for your support. I appreciate your time.
Thank you, Ms. Woods. Adrian, I didn't even realize I didn't have my glasses on, so I didn't realize that was you sitting over there. We know that Safe Passage is in good hands now that you're directing them. It's good to see you again. We appreciate the good work that you do for our community.
Thank you. I appreciate it.
Thank you.
Is there anyone else here who wishes to speak at the public hearing?
Move close.
Second.
Motion and a second. Any discussion? All those in favor say aye.
Aye.
Any opposed? Hearing none, motion passes, and public hearing is now adjourned.